Welcome to the Physician Pharmacist podcast, a show designed to shed some light on a very unusual pathway into medicine. I'm your host, Nathan Garland. I'm a licensed pharmacist and third-year medical student. I'm also the author of PharmD to MD and the owner of the Physician Pharmacist Company. Most pharmacy students and professional graduates are aware of the possibility of going to medical school, but very few actually take the leap. We're here to unpack some of these details and open your eyes to the possibility of a career in both pharmacy and medicine. I'm very excited for our special guest today, Dr. Caroline Jones. Dr. Jones is a recent graduated pharmacist from Drake University College of Pharmacy and Health Sciences and current first-year medical student at Washington University School of Medicine, St. Louis. Having navigated the medical school application cycle independently, I'm really excited for this interview and to hear about her journey. Welcome to the show, Dr. Jones.
Thanks so much for having me.
All righty. Well, let's unpack things right there. What got you started in pharmacy in the first place?
Yeah, I first started becoming interested in pharmacy when I was a sophomore in high school. I started volunteering at a local hospital where I grew up, and I had never really considered anything in the healthcare field outside of, I knew what physicians were, I knew nurses worked in the healthcare field, PT, but hadn't given it much thought. And one of the older students was going into pharmacy and really shared with me how pharmacists do a lot more than just community jobs. They can also work in the hospital. They can do many other roles. And that really interested me at the time. And I stuck with it and decided I'm really interested in science. Medications sound interesting, and this seems like a cool career path.
That's awesome. And did you say a 2+4, or was it did you do 4 years of undergrad and then 4 years of pharmacy school?
I did a 2+4 program, so the 2 years of undergrad and
Okay.
then into the PharmD.
Excellent, excellent. Yeah, I ended up doing the same as well. So I guess
Yeah.
then, since you were obviously interested in pharmacy at the time, when did you kind of get that itch where you were thinking about medical school?
Sure. I first got that kind of itch in the very end of the 2 years, my first 2 years of college. I took an anatomy and physiology course that was actually meant to fulfill a requirement for my biology minor that I was just doing out of pure interest, and ended up in kind of a pre-med weed out course, which ended up kind of weeding me in coincidentally. And it was right before I started pharmacy school, really close to when I started. And I started thinking, wow, I really love the anatomy. I really love physiology and, thinking about diagnoses and dissections as well. And that kind of got that itch growing a little bit. But I decided, I really love pharmacy. I think it's still what I want to do. So I still went into pharmacy school. And during the first 2 years of pharmacy school, it was a really big struggle for me because I really enjoyed pharmacy, but I still kind of had that feeling of, oh, maybe I want to go to medical school. And although I enjoy pharmacy a lot, I realized that what I was really enjoying was the physiology, the pathophysiology. And by the end of my second year of pharmacy school, once I had had some clinical experiences, that's when I really realized that I want to go to medical school.
That's super interesting. Yeah, because that early experience that you had really shifted your whole mindset in the sense that, like, basically you had medicine on your radar despite, being in pharmacy school. I think that's super interesting. For
Mhm.
myself, like I had never even taken an anatomy class until I had first set foot into medical school. So I thought that was
Oh, wow.
definitely a challenge for me. I'm curious, I'll ask you in a little bit how that turned out for you, but so
Sure.
that's awesome. So then you started transitioning away from pharmacy, probably, I guess, 4 years in, you said about halfway through pharmacy school. That's when you started
Yes,
to kind of put the pieces together and say, all right, we're going to give this a try. We're going to apply to medical school. So
exactly.
did you ever consider pharmacy residencies?
I did. For my first 2 years of pharmacy school, I was really set on a residency, actually. If I'm not doing medical school, I would love to do a residency. At the time, I really thought I would be interested in being a critical care pharmacist or a cardiology pharmacist. And then afterwards, I briefly considered doing a residency just for the knowledge and the training that comes with it, but ultimately decided not to do one.
Yeah, I think a lot of people, especially in pharmacy, who are interested in residency programs, they're super qualified to obviously apply to medical school. So similar to you, you were kind of on that path to become a or a pharmacy resident and kind of doing all the right things, checking all those boxes off. And I felt that for me personally, it helped a lot with kind of preparing me for the medical school application process. So just having, I guess, without even knowing that I was helping myself out for a medical school application, just doing the stuff necessary for pharmacy residency apps, it really went a far way for me, at least. Would you agree?
I would totally agree. I still say now that my medical school application would not have been as strong as it was without the experiences I had in pharmacy school that I thought about doing to be a competitive applicant for pharmacy residencies. And I'm very grateful that I've had those experiences from pharmacy school because they did prepare me a lot for that application process.
So speaking of applications, I'm curious to hear a little bit about what that was like, applying for medical school while simultaneously completing pharmacy school. I have my own experiences that I've shared on the podcast before, but I'm curious to see how you went through it all.
So I would have been in the application process between my third year of pharmacy school and my fourth year. So I took the MCAT during my P3 or third year of pharmacy school in January, and then I applied when during my rotations. And honestly, it was quite difficult. It's something that I look back on now and realize, wow, that was pretty lofty in terms of ambition with the amount of classes we take in pharmacy school and the amount of time you spend on rotations. So it was definitely difficult. I'd say it was worth it. But studying for the MCAT, fitting that into my schedule, I'm sure you know, just being in pharmacy school, you've got your classes and you're working, you're doing research, leadership opportunities. And so fitting that in was a little bit more difficult. And then during rotations, I was fortunate to have my off block during the summer. So my full 5 weeks that I had off was when all of the secondary applications for medical school came out. So I was very lucky that I had that time off to work on them because that was a lot of work.
Yeah, I definitely recommend that to anyone listening to this. If you are planning on going to medical school, putting those off blocks in strategic locations, probably one during application season and then one during interview season. I say interview season because that can be kind of a long period of time, but it definitely helps a lot because not having to balance your 40-hour work week on top of all the extra stuff that comes with medical school applications, especially time-sensitive emails. So I definitely recommend that, and I think you made a good choice with that. With
Yes.
regards to the MCAT, everyone wants to hear more about that experience and what that was like. So can you tell me, I guess, how you adapted to studying for that while in pharmacy school? How did you even make that a possibility?
Yes. So to start, I did some lighter part-time studying during the fall semester before I took it the next January. And
Hmm.
I'd say I was not studying quite as much as I would have liked to. I ended up having an urgent surgery during that semester. It was just kind of a crazy time
Oh, wow.
where things just went a little haywire. And I was like, oh, I don't know if I can take this exam as soon as I would like to. But it ended up working out. So I would study, I'd say, about 5 to 10 hours a week. I was not taking an elective that semester, which helped a lot. I had already
Hmm.
finished those requirements. And really, then it just consisted of some light content review, as well as I used Anki cards, a pre-made deck. And I would
Okay.
just do a certain number each day. And if that was all I got done that day, plus one CARS passage, then that was fine. Anything more than that was just a cherry on top for me. But I was really fortunate that for my winter break, before I took the test that January, I believe I took it on January 25th. Both winter break and COVID kind of worked out in my favor because at Drake, we have something called a J term. So not only did I have part of December off, but I also had most of January off. And the last week of January was our spring break because they moved it from the spring break normal time to January because of
Hmm.
COVID. They didn't want people coming to and from campus. And so I studied full time from the time I got off, which would have been mid-December after finals, all the way through January, and used a pretty intense schedule. I gave myself about one day off a week and then studied every other day. I took a practice exam at least every week, if not more, and then studied full time, which I was lucky to have that schedule, and that helped a lot with studying for the MCAT.
That's great. Yeah, having that extra time added on, I'm sure was super nice. It probably wasn't going to delay your schedule too much, but just having that extra week of like uninhibited syllabus week classes is just probably made a whole lot of difference. And it sounds like you did it right because you only had to take the MCAT once, it sounds like. So
I
unlike
did,
myself.
yes. I was concerned because I was hoping, I was like, well, I have to take it in March if it doesn't go well this time. But it went well, luckily, and I'm very glad I didn't have to worry about it again.
That's great. That's great. So that, and also taking it early. You said you applied, I guess, back in May, so you took it in January. So you had a couple months to kind of really fine tune your application, do a lot of pre-writing, that kind of stuff, I'm assuming.
I did. And that was really the goal with the January MCAT. Since I knew I would be going right into rotations, I didn't want to be super worried about getting things done then. So I spent a lot of time pre-writing my application during that spring semester. And I just really wanted to get it done early. And at the time, I didn't really know a lot about applying to medical school. That year before, I'd been doing a lot of research on my own and, of course, reading online people's advice. And I'd
Mhm.
always heard apply early. So I wanted to do everything just about as early as I could.
That's awesome. And so I guess that's super interesting because I've never actually spoken to any other like pharmacy student who's gone to medical school who's actually taken their exam in January. So you're the first one, at least that I'm aware of. But
Yeah,
definitely it's smart because yeah, you have to apply early. And I think to all the pharmacy students listening, a lot of research obviously is important, but taking the MCAT is really the first step to kind of getting things into motion. And then once you know what your MCAT score is, then you can kind of fine tune to figure out, oh, do I need to do a retake? Do I need to do more research or figure out more information about the application cycle? Once you kind of get that MCAT out of the way, then a lot of things start to fall into place, which is super nice.
exactly. And I was really fortunate that I was in the last part of the COVID cohort where I got my scores 2 weeks earlier. So that
Oh,
also really helped with planning.
wow. I didn't even realize. So they cut it down from a month to 2 weeks
They
or
did.
wow. So it is possible to get it back faster. Oh my goodness. They're just making us stress out for longer periods of time. That's all.
I know. I was very glad I didn't have to wait the extra 2 weeks.
Oh, geez. Well, I think they're back to the 1 month, but maybe I'll have to double check that. So, anyone listening who's applying, make sure you double check that so you can be aware of what kind of time constraints you'll have. And so,
Hmm.
additionally, how many programs did you end up applying to? I think the general recommendation is around, I think the average is around 17 to 18 programs. I'm a big advocate for applying broadly, but I think it also needs to be individualized to the student. How about yourself?
Yes. So originally, I believe I sent my primary to, I think, around 23 to 25 schools. And
Hmm.
then once secondary started coming in, there were a couple of mishaps with the pharmacy degree. A couple of schools couldn't process the 2 years plus the four without the bachelor's. And so the secondaries got a little messed up, and I didn't end up submitting secondaries to one because of that. And then I ended up too busy with rotations that I cut off another few schools off that list. But ultimately, I believe I sent my secondary applications to 17 schools.
Okay, right. So right on the money. And I think it's a good idea to apply to a few over the threshold so that like same experience that you had where, a couple mishaps, a couple things don't work out and you still have a pretty good size school list where you kind of move on to the next stage of things.
Yes, I was very careful in planning out how many schools I had. I had a full spreadsheet and a rating system for whether it was Target or Reach or
Hmm.
and so I was really wanting to apply broadly just out of the fear that, oh wow, I don't know how the cycle is going to go.
Yeah, you never know. Sometimes you can just get a bad reviewer and your chances can go down the drain. So you want to have a cast a wide net and see what you catch. But
Exactly.
so additionally, we've talked about the MCAT, and that's important, obviously having a good GPA. What other things could you recommend to the listeners that they should do to, I guess, facilitate, a better medical school application?
I think for any medical school applicant, especially pharmacy students, but anybody, really is just being a well-rounded applicant. I think not only checking off the boxes, having maybe research experience or clinical experience, but also doing the things that you enjoy and being able to talk about your experiences. Because I think even if you do check off boxes, say you have this one research position or a leadership position, volunteering, if you're not able to talk about those things in depth and passionately and about how they have either shaped you as a person and will shape you in the future, then it's really not going to matter quite as much. The hours aren't as big of a deal.
Hmm.
And so I think for me, it was really important to come in with experiences that have bettered me as a person and have influenced what I want to do in the future, as well as just being well-rounded in general. So hobbies and other involvements that I've enjoyed and might make me stand out, but even aside from standing out, there's so many people in this world that sometimes that's difficult, but being able to speak about those experiences well.
I love that for sure because everyone can get 10 shadowing hours at a doctor's office or, participate in a poster presentation. But what does that really mean for an applicant? And having
Mm-hmm.
the skills to kind of convey how that has been influential in the person that you are, I think is so important. And I think pharmacy school does a really good job fostering that professionalism that gives you
Yes.
that perspective that you can then sit there and kind of talk through some of these experiences and sit there and think about how it's influenced you. So I guess to add on that, how do you think like your pharmacy education has really, I guess, bolstered your experience?
Oh, wow. I would say it has bolstered my experience in so many different ways. I mean, first of all, we've just discussed the professional development that comes with pharmacy school. I feel like a lot of pharmacy schools, and especially where I went to school, they really foster you as an individual in developing your professional identity. Who are you as a professional? What do you want to be involved in? And so not only did pharmacy school help me bolster my application, and various experiences, like I was a research assistant, and that was so influential for me in leadership and volunteering, but also in general with classes, just the knowledge that comes from pharmacy
Hmm.
school. I've already been able to tell in medical school. I haven't taken anatomy yet in medical school. That actually starts for us in January.
Okay.
But um, a lot of physicians that I've talked to in the past, I spoke to some PharmD MDs before when I was making my decision. And they told me, pharmacy school, you learn so much. And medical school, in some areas, you just go deeper. And I feel like that has really rung true in my experience, not only in the drugs and therapeutic side of things, and of course, the pharmacology lectures in medical school, but also the physiology, the pathophysiology. And
Hmm.
then in addition to that, I feel like pharmacy school gave me a unique clinical experience, especially being on rotations for a full year. You know this well. We've had the experience of being on rounds, on being an integral part of the care team, writing notes, making recommendations, and just seeing that in action. And it's also given me what I consider an important interprofessional perspective. I'm really passionate about interprofessional collaboration. And it's really interesting to come to medical school with another perspective on the team that not everybody has. And I think that's great.
Yeah, you couldn't have said it better right there, especially that interprofessional point. I think having that experience and exposure as just an applicant compared to some of the peers that who are sitting next to you in the interview room, it just goes so far because you have that experience, that exposure where you've worked with the nursing team, you've worked with the physicians, you've worked with pharmacy, obviously, and you have the knowledge base and the internal workings of how all of these teams come together to provide medical care. A lot of the times, anyone else who isn't in pharmacy school, it's really just a couple shadowing experiences here and there. And we've had an
Mm-hmm.
entire year's worth of time sitting there working with the team and actually contributing. So it's very helpful, and I think it's a great way. I guess it really helps when it comes to applications. Medical school interviews, they love to hear about this kind of stuff.
Yes, they did.
So you kind of started talking a little bit about medical school so far. So I'm curious to know how have things been? How was the transition into the program?
They've been going really well. Now that I'm kind of done with my first semester, I'm looking back on the last few months, and honestly, they flew by, which I was expecting, but it always goes faster than you think it will. And I was a little apprehensive coming into medical school because in my experience in the past, you always hear the horror stories. Oh, it's so difficult. You're never going to have a life. You're just
Hmm.
going to be studying yourself to death. And I like to come into things with an open mind. And I knew that I was going to have knowledge and experiences that would help me. And they really have, because my school, we have a really great curriculum. It's called the Gateway Curriculum. And we have module systems, and each one focuses on a specific theme. And then all of the classes within that are related to that. And so far, we've finished two modules, and I feel like my pharmacy experience not only has helped with the pharmacology and some of the drugs lectures that we've had, we haven't had too many, but it's also just helped with approaching graduate school and medical school and life. I think as a past pharmacy student, I really got into my groove with how do I balance studying for intense doctoral courses in addition to balancing everything else. And I always compare the two, and it's a different type of busy almost compared to pharmacy school, because in
Hmm.
pharmacy school, some weeks I was working 35 hours a week, or I was president of this and that and doing research for X amount of hours a week.
Hmm.
And balancing those things really helped me form a discipline for studying, of how do I sit down and approach studying this high amount of information. And I think that's helped in medical school because I'm not quite as overwhelmed with the amount of information that we're getting. It still is a lot of information and it's
Of course.
difficult, but I understand myself enough to know this is how I should approach this. This is how I should study this. And I know myself well enough to go, I cannot study so much that I have no free time, because I realized very quickly in pharmacy school that when I do balance wellness and I balance some downtime, I will score better and I will be more refreshed. And so coming into medical school with that mindset, I think has really helped me in approaching how I study, how I am balancing being a medical student, but also just being a human who has other interests and wants to de-stress.
Exactly. I think the main points there are definitely, personal wellness.
Mm-hmm.
No student can make it through medical school without taking time away to just decompress after a long day of work, after a long day of studying. You really need to come back and still do the things that you enjoy and that you love. I think
Exactly.
that's super important. And those lessons you learned in pharmacy school obviously kind of transcended into this period of your life, and it's allowed you to succeed. And the
Yes.
second point I wanted to address was you mentioned discipline, and that's spot on because at least in my experience, I've seen definitely my classmates, especially when we first started out, everyone's kind of adjusted at this point, but having that initial expectation of what graduate level education is like, I think goes a long way for pharmacy students in the sense that like day one, I was already hitting the books. I knew exactly how much like studying I needed to get done to basically make sure I had time for my well-being, my time off to go to the gym or just to even read a book or something outside of medicine.
Mhm.
So having that kind of perspective goes a long way. And it's some of the other students who might not have had that rigorous structure or schedule kind of struggle in that first couple months of time. Obviously, everyone's collaborative and works together to kind of help everyone out and get to those different points. But I think that it definitely helped me hit the ground running. And it sounds like you were the same way.
Exactly. I think that discipline formed in pharmacy school, just being able to know, what, I should maybe, it's the first week of a module. Maybe I should review this for an hour tonight and help myself further down the road because it's going to catch up to me. And I think that's where my MCAT studying also came in, was because studying for that, even though it was light, I would sometimes wake up at 5:30 in the morning and study for, I'm a morning person. I'll
Okay,
preface
me
that.
as
So
well.
maybe if someone's a night person, they should flip this to nighttime. But I would spend, an hour, half an hour in the morning before classes started or before work, studying. I think that MCAT studying really instilled in me, okay, we can do the hard things, we can work hard, and you can really put your schedule down to the minute. And I don't do that anymore. I don't have to right now, but
Hmm.
I think it really helps with that approach to medical school and knowing, okay, this is what I need to do to succeed and also make sure I'm not super behind.
Yeah, once like the first couple months kind of pass by, everyone kind of shifts into their own little rhythm. I'm sure you've noticed that too, and everyone kind of figures out which study strategy works for them. You said that you were an
Hmm.
Anki person for the MCAT, so I'm assuming
Yes.
you continue to use Anki primarily for your medical school stuff. Um,
Surprisingly, I have not.
no, really good.
Um, no,
I'm not an
I
Anki guy.
you're not. See, this is interesting to hear because I just haven't found a deck that really aligns with the curriculum that I've learned so far. And
Hmm.
each time I tell myself, I might try Anki for the next block. And it really hasn't. I prefer to make my own flashcards, but I'm kind of open to it. We'll see.
Yeah, I try to hype myself up for every new like shelf exam that comes up, like, oh, I'm gonna use Anki. This is gonna be the test I do it, and then it just I don't get around to it. I'm too busy with UWorld or external resources to really get into it. Because it has to be something that you're really disciplined for. You have to do it every single day or you fall behind pretty quickly. So
Yes, you do.
for our listeners, Anki is a basically like an app that you download onto your laptop or onto your phone, and then it's basically like flashcards, but they're smart flashcards in the sense that it you kind of set predetermined time points of how frequently you want them to show up based on how difficult or easy they are. So that's probably the best way to describe it. And there's decks for step one. The deck has, I think it's up to 36,000 cards now. So it's quite a bit of cards to get through. So
Yeah, it's a lot.
yeah, it's quite a bit. So you have to do a lot of cards every single day, and then you get repeats and stuff. So it takes a while to get through everything. But cool. So you don't really use that. You've kind of figured out your own study strategy at this point in time. I'm curious to know, have you come across anything that you found more challenging than you were expecting in medical school? We talk about how, I guess, how great the pharmacy education is and how much it prepares us for medical school, but there's definitely things that, might have been a little more challenging than you anticipated. I'm curious to hear if that is something you came across, and I can share my own afterwards.
Yeah, that's a great question. I think what I found most challenging is still the amount of information that we do have to learn. In
Hmm.
pharmacy school, I was kind of used to sectioning everything out in my head. I'd have a therapeutics exam on Wednesday and then a pharmacology exam 2 days after. So it was never all bundled together in my mind, if that makes sense. Whereas in medical school, we just have one exam at the end of, or one exam in the middle and one exam at the end of each module, typically,
Hmm.
where all of the classes we've had prior to that will be on that one exam. And so I think getting adjusted to medical school, a few of the exams just included a lot of hodgepodge of information, especially more of the basic sciences kind of thing to introduce us to medical school. And it was really just getting used to that amount of information, as well as just it's a lot of different things that aren't quite as cohesive as we start our organ blocks in January. So in my head, I'm thinking, oh, well, if it's all related to one system, it kind of intermixes and makes a little bit more sense there. But that might change. So, but for now, that's what I found the most difficult.
You're not wrong about the volume for sure. I think
Yes.
for just to share my side of my experience, at least with anatomy, I know you haven't taken anatomy yet, but I did not enjoy that class particularly just because it was something so fresh and so new because I had never
Hmm.
taken a course, like a basic anatomy course ever in my
Oh,
life.
wow.
So it was like a gross anatomy course. So that the volume there and the level of which we need to know like each neuron and branch and everything and muscle supply and all this stuff. Um, I've obviously already forgotten most of it at this point, but that was definitely a challenging course because there was just the volume was something I had never seen before with something that I was so unfamiliar with. You know, a
Yes.
lot of these pharmacy classes in the past kind of build off of, and other classes in medical school build off of like basic science principles, and they just kind of take it the next step, like we were talking about. But with this, I was kind of starting from the ground up, and that was something I was expecting, but I wasn't expecting at the same time. So good luck with anatomy. I
Yes.
don't want to scare you away.
Thank you. No, I'm definitely curious to see how it will go. Luckily, I have taken an anatomy course, but it was 4.5 years ago. However, it did come into handy because during that course, I remember our professor told us we were learning about cranial, caudal, dorsal, ventral, and just different things. She even
Hmm.
taught us embryology, and she goes, remember this stuff because you will all use it in medical school. And at the time, I remember thinking, oh man, I can't remember what I had for lunch yesterday. I don't know if I'll remember this if I ever go to medical school in 4.5, 5 years. And sure enough, I did because she was a great professor and that class stuck with me. So I'm hoping a little bit of that class sticks with me in anatomy lab and gross anatomy, but we'll see how that goes.
And hopefully they don't ask you too many embryology questions. Those are always just so difficult.
They really are. That might have been the most difficult part of our first exam in medical school.
Oh, geez. Well,
Yeah.
keep on trucking. So I'm curious to know then, what are you looking forward to most about medical school? Obviously, you just finished your first semester. You're probably, just trying to decompress and not even think about school. But what is something I guess you're looking forward to next semester and then maybe a little bit further into the future?
Yes. Wow. I am so excited for the rest of medical school. I think it's been something that I had as a concept in my mind for so long. I'm studying for the MCAT, I'm applying for medical school. But now the fact that I'm here is just such a great feeling. And sometimes I have to stop myself and realize, wow, I'm actually here. And first of all, just the knowledge. I love to learn. I'm a very curious person. So I'm really excited to learn, so much about the breadth of, human anatomy, human diseases, and how we treat people who are presenting with whatever. And I think to me, what really interested me about medicine was the puzzle that comes with it. It's kind of the
Hmm.
logic, because I love pharmacy, and as much as I love pharmacy, a lot of it is it's so important with that implementation of the care plan and monitoring. But I realized I really wanted to be on the side of it where you're determining the care plan, you're solving that puzzle, the diagnosis, you're doing procedures, and then you're directing the rest of the care plan as a physician. And I'm so excited to learn about that mindset, not only the knowledge required to take someone who's presenting with XYZ and come up with a diagnosis from that or solve that problem with a procedure, but also just working with patients in general. I love patient contact, and I'm so excited in the future to be able to work alongside patients to determine what is going on and how we can create a solution for that going forward in the future.
That's awesome. Yeah, I think one of the most fulfilling things, especially about medicine, is seeing those skills that you've kind of invested all this time into learning and obtaining, and all the medical knowledge that comes with it, and seeing that actually put into practice and seeing the results of the interventions that you actually make. So, for instance, I'm on clinical rotations right now, and it's just fascinating to see where I kind of look back at my first year of medical school. I was like, wow, that went really fast. And I knew nothing about all these different diseases and how to interview a patient or how to even, like take a blood pressure to at least accurately. So now it's just crazy to see how far we've gone. And now I've had surgery rotations already and I'm operating in the OR. And it's pretty cool to actually then go talk to the patient an hour later. And, just it's just a very rewarding experience. And it's very
Yes.
cool. So I'm glad that you share the same passion for this career. Obviously, you wouldn't be doing it if you didn't, but
Exactly. And I totally agree with you. I'm so excited for clerkships and rotations as a medical student because I think that was one of my favorite parts of pharmacy school was you can only learn so much in the classroom and
hmm.
remember so much. And then once I got onto those clinical rotations, at least in pharmacy school, seeing it in action is totally different. And the information sticks with you and the amount that you learn, even if it's just how to work with a patient and or take a blood pressure, something I'm still working on. It's just really great to be actually right there seeing it in real life.
Yeah, I'll say like you're way more likely to remember some unique patient encounter or experience or, positive outcome than you are to remember 20 lines from a textbook about the same disease.
Yes,
But
exactly.
great. So obviously you love medicine, but what particular specialty are you interested at the moment? I know this is going to change a couple times over. It has for me personally, but I'm curious to know what you're aiming at right now.
Yeah. Going into medical school, I would have said cardiology. I did a cardiology rotation last year at Mayo Clinic in Rochester that absolutely changed my outlook on medicine. I lived and breathed that rotation. I loved it so much. And it's still, I'd say it's in a solid number two spot for me right now. But right now, I really like anesthesiology
Okay.
because I've shadowed it a little bit and I love the procedural aspect. I really love being in the OR, that environment. So that's my number one, but I'm interested in partially procedural, I think, maybe even like an interventional radiology I'm really interested in. So we'll see, but I'd say anesthesia for now.
That's awesome. I'm personally interested in anesthesia at the moment too. So we're kind of figuring out. I have a sub-I coming up for it, so I'm excited. But you're right, of
Oh,
all the
wow.
procedural stuff that comes with it. I had my time on the other side of the curtain in the OR, and I think that's all the time I need. Um,
It was an automatic no.
yeah, it wasn't my favorite, but I think obviously we need people to do that, and there's obviously a lot of people who are very passionate. All of my friends want to do surgery, so it's just kind of funny. But
Hmm.
anesthesia, just the hands-on stuff, I think it's exciting. You kind of move around to different ORs all the time. You get to see a lot of cool things, work with a lot of patients, and so it's something I'm super excited about. But I'm glad to hear that you're interested in it at the moment.
Yeah.
Unfortunately, it'll probably be some time before you can really get in there, and start
Hmm.
putting lines in yourself and doing intubations. But that really comes out, I guess, during your third year. But depending on the preceptor, you might be able to get some early exposure. I recommend you reach out and ask around.
Yes, we'll see. And that's really interesting that you're interested in it. I feel like a lot of times when I told people, oh, I want to go to medical school, they say, oh, so do you want to be an anesthesiologist? And it makes sense. We know we like drugs and pharmacology already. But there's so much more to it than that. So that's really interesting. I hope your sub-I goes well.
Yeah, thank you so much. I have a couple months before I have to worry about that, but you're right too about the pharmacy aspect. Yeah, just having the familiarity with the drugs, like, oh, this is propofol, or oh, we're using sevoflurane today, that kind of stuff. Like
Mhm.
those are drugs that some, a lay person may ne have never even heard about, but because of the pharmacy education, it's something, not to say we're experts on, because those are very specific meds, but we have that baseline foundation, I think. But
Yes.
anyways, so obviously you're on the podcast today. I get the impression you're very passionate about, your journey, your experience, and obviously you want to help other students. So I guess how do you plan on staying connected with the pharmacy community as you kind of transcend and continue out medical school?
Yes. I think for now, so I'm pretty active on LinkedIn, and of course, I want to stay connected to all my classmates and my friends from pharmacy school. And I think it was really common in pharmacy school. I don't know if yours told you this, but we heard all the time, pharmacy is a small world. And it's something you don't really realize until you're fully in it. And it really is a small world. And I think that can even be extended in general to medicine is a small world. And so not only do I want to stay connected to my classmates who are in their residencies or working in the community or going on to do fellowships, but also being able to look at myself as a physician and know that I will be working with my pharmacy colleagues in the future. They may be people that I've known from the past or know people that I know, or they just might be a pharmacist that I've never met before. And so I think being connected both in a networking sense of way with the people that I've got on LinkedIn or, someone I might meet at a conference, but also taking time to meet my colleagues where I'm going to be practicing in the future. And I think using them as such a great resource, but also just that collaboration between both of us is going to be really important for me.
Yeah, you're spot on with pharmacy is a small world. I would also argue that the physician pharmacist portfolio is also a very, very small world.
Yes,
But you're right. I mean, it serves as a great way to bridge between the two professions. And I think we can be, great tools to kind of advocate for both, the skill sets of both professions. So I hope to continue that. And obviously, you as well.
exactly. Yes. I love pharmacy still. I think it's a great profession. And I have so much respect for it as a profession that all of my classmates know, someone came up to me once and they were like, oh wow, the antibiotics they're tough. I'm nervous about having to do this as a provider. And I said, well, you'll have a pharmacist to help you. So even just advocating for pharmacists now, I'm like, don't worry. You're going to be working with a great team who can help you with this in the future. You still have to learn it. It's very important, but we're going to be part of a team.
You're right. The cephalosporins are the bane of my classmates' existence.
Yeah, that's exactly what it was about, actually.
Yeah, it's funny. It
Yeah.
it goes everywhere. But I guess
Hmm.
kind of keeping in contact with pharmacy. I'm assuming you're licensed. Do you plan on working at all throughout pharmacy or through medical school?
I don't actually. So I decided not to get my license,
Oh, okay.
actually. I was planning on getting licensed this past summer, and
Hmm.
I even studied for the NAPLEX for a couple of weeks, but ultimately I decided not to. I decided to take the summer off. It was a difficult decision for me because pharmacy has been so much of my life up until this point in identity. But I decided I was going to actually take the summer off before medical school and just rest. And so I
Smart.
don't plan on working. Yeah. I thought about working in medical school and I think it's such a great option, but ultimately decided it wasn't for me.
Absolutely. I think that's smart that taking time off before because I definitely entered medical school a little burnt out because
Hmm.
I was studying for and I live in New York, so I was taking three board exams at the time,
Oh, wow.
NAPLEX, the law exam, and then the compounding exam.
Hmm.
And of course they got rid of the compounding exam after I completed it, but thanks to COVID. But anyways, like I took my last pharmacy board on the first day of medical school. I ended up
Oh
missing the
my
first day of med
goodness.
school because I was busy, taking this board.
Oh,
So
wow.
I definitely did not get a time off that I think I needed, and I would definitely would recommend you did the right thing in that sense, like having that ability to kind of decompress after a long 6 years of pharmacy education. Um,
Yes.
and yeah, and to kind of build on that too, I think you're totally in your lane too, in the sense that like working during medical school is definitely challenging as a pharmacist because there's responsibilities and stuff that come with that, obviously. And there's so many other things that you can do to kind of bolster your application for residency that I feel like working did not necessarily help me with. For instance, I work a little bit, not a crazy amount or anything like that, but because of that, I think my research exposure, my commitment to research has been rather limited. So I think you'll have the
Hmm.
opportunity to make up for a lot of that time with other ways that you can help with your future residency application.
Yeah, that's good to hear because that was definitely part of my thought process going into it. So, and there's so many different paths, and so I think I'm on the right one for sure.
All right, so Caroline, we're coming to the end of our interview right now. Do you have any last minute advice for pharmacists interested in pursuing a career in medicine?
Yes. So I think really, as for advice, I think if you think that you might be interested in medicine, I think really just learning about the profession itself is so big. For me personally, I cold emailed a few PharmD MDs where I lived, and I was able to get into contact with a couple who were nice enough to talk to me over the phone because it was COVID, we couldn't meet up. And they gave me a lot of advice. And I asked each and every one of them, I said, do you think if you went back in time that you would make a different decision? And they all said no, that it had been worth it for them. And that was really influential to me because I had talked to a lot of professionals in the pharmacy field who said, "Oh, I really wanted to go to medical school when I was this age or coming out of school or after residency." And I decided not to, but I kind of regret that a little bit. And I think if you're interested, take that leap and maybe look at, okay, what is in this field that I could do or I might be interested in, and talk to other people who might be able to help you out a little bit. And then from there, bolster your application as a pharmacist. If they're already working, then they've got a fantastic set of experiences that's going to help them in medical school and probably all of their pharmacy school experiences as well. But for me personally, I just didn't want to look back and think to myself, I wish I had really taken that leap. So I think giving yourself as much information as possible about, do I want to go to medical school, and taking all of that to make an informed decision is so important.
Yeah, I think that's what's like super important as well, especially like that's kind of what the physician pharmacist mission is to basically provide that opportunity to just even the information to say this is a possible avenue that you could take with your PharmD. Obviously,
Mm-hmm.
the traditional, education of pharmacy kind of funnels people down the community pathway and then the residency pathway. A couple people, split off and do fellowships, and then the rest is, those very, very niche jobs like long-term care or maybe like nuclear pharmacy. And I don't think a lot of people are aware of the possibility of even going to medical school. That's something that never really crosses their mind. Maybe even law school or getting a PhD afterwards. So I think that's just super important that you, like you said, explore all of those options and get that information so that you're not looking back 10, 20 years from now thinking, wow, I really wish I did this, or, is this really what I want for my career? So I think that's great advice.
Exactly. Thank you.
Alrighty, so we've come to the end of the interview, and I'd like to thank all of our listeners for the support. If you have any additional questions about the medical school journey, feel free to check out my website at www.physicianpharmacist.com. Before we let you go, Dr. Jones, how can our listeners, I guess, get in touch with you?
Yes, you can reach out to me on LinkedIn. My name on there is Caroline Jones, PharmD. I believe I'm connected with you on there, but I can also put a link to that in your show notes if you have that.
Yep, I'll definitely
Um,
make sure that happens.
yeah, feel free to message me on LinkedIn. I'm always happy to give out my email on there or phone number, have a chat on Zoom. I really love talking to anybody who's considering this path because for me, I didn't know anybody that was going through this pathway. As you said, we talk about other ways to bolster your career after pharmacy school, but this wasn't one I was quite as aware of. So I'm always happy to talk with people who are interested in it.
Fantastic. And I'm just curious to know what final question. So you were the only person in your class to go to medical school afterwards. Was there anyone in the class above or below?
Oh, there was one individual in the class above me who went to podiatry school.
Okay.
And then before that, the only person I had heard of was about 10 years older. But however, another individual from Drake, who was a couple years older than me, and I believe ended up going to medical school after completing residency. Other than that, I'm not aware of anybody else.
That's awesome. So you really paved the path by yourself. So kudos to you.
Thank you.
Alrighty. Well, thank you so much for being on the podcast today, Caroline. And I recognize you're really busy and this is your protected time off. So I really do appreciate you coming on the show today.
Yeah, thank you so much for having me. I always enjoy talking about this, and I think it's great that you're getting this information out there. I think it's a great podcast to be on and to listen to.
All right, fantastic. Well, take care and enjoy the holidays.
Thanks, you too.
Bye-bye.